Welcome to Mighty Married Moms. Join us at our kitchen table twice a week as the Mighty Married Moms, Debbie, Linda, Wendy, invite spectacular guests to weigh in on staying sexy, vibrant, and healthy, building marriages with soul-satisfying connection, raising happy, healthy, successful kids. Conversations with Mighty Married Moms will bring you closer to the life you really want. Episode 30.
Hi, and welcome to Mighty Married Moms. We just had a great conversation with Dr. Bradley Weiss. He's a chiropractor and the director of Performance Health Center in Natick, Massachusetts. He's a certified ART specialist, which we talked about. We'll talk about more today, what we learned. But it was a very inspiring conversation talking about, because we are all about wellness and preventative health and making sure that you, when you get to 90, that you are fit and, you're not all hunched over and on a cane and feeling bad. You want to age. We want a long health span, not just a long lifespan, right? So,
that's right. I like that.
Yeah. So, and I'm a patient of Dr. Weiss, and I think he's really an incredible chiropractor. So I really wanted to talk with him and share him with all of you because he's really quite spectacular. So we talked about, the importance of chiropractic care. He told us that even an infant just after being born
that was amazing to me. I had no idea. I mean, I guess if I thought about it, I would say, oh, that makes sense. But It's not something I had ever thought about before, and that was, does an infant need to have chiropractic care? And his analogy, well, it wasn't even an analogy, it was a description of going through the birth canal. What was it he said?
The most gymnastic thing that any human being could ever do.
Yeah, which of course makes perfect sense, right? I mean,
that's right.
Babies are born with their heads all like,
Or
Or
as in some cases, one of my kids had to be pulled out with forceps. I mean, it's not an easy thing.
Quite a traumatic.
Very traumatic.
Traumatic event,
traumatic.
for sure.
Yeah.
So it made sense, but I don't think most of us think chiropractic care.
Right.
When your baby is born, it's really something very different. And I think most of us also think of chiropractic care when you get an injury. I have a car accident or I have an injury, so I go to the chiropractor, not really considering the fact that if you are consistently going, that you may prevent those injuries or, I work with a lot of people who are older. I'm a fitness trainer as well, and a lot of hip replacements, knee replacements, shoulder surgeries, all of these things. And I think a lot of these things, and arthritis. He talked about arthritis, which I thought was very, very fascinating, that his research shows and his experience that getting regular chiropractic care can actually slow down or stop the growth of arthritis. And regular osteoarthritis, not rheumatoid arthritis, but arthritis is caused from not moving your joints.
He says it's like rusting, which makes sense to me too. Just kind of sitting out in the rain, like not doing anything, not moving. It totally makes sense. And I was chiropractic is definitely something that's been part of my life for injuries. The car accident, the low back pain, or whatever, something. So I've definitely taken advantage of it, but I haven't really built it in as a preventative measure or as a wellness measure. And you and your family inspire me that's part of how you take care of yourself and your kids. And I hadn't really ever thought. I mean, I shouldn't say I haven't thought about it. The doctor always make sure that might be something I want to consider, but I haven't followed through on it. But it really makes great sense because why I might not have as many lower back problems if I kept up. And it's kind of, I was just thinking when you were describing it a little bit, when you say, you build it in with your primary care doctor. Well, when you go to the primary care doctor, they're just kind of observing you to see how you're doing. They don't necessarily, they examine you, but they don't do things to you. They don't just give you medications or treat you unless there's something wrong. Whereas if you go to a chiropractor on a regular basis, they are touching you. They are making sure that you're structurally sound and that you're in alignment and stuff like that. So it's a different sort of a. Am I making sense?
Oh yeah, absolutely. It's a whole different mindset. Actually,
absolutely.
Yeah, it's a different mindset, and you've hit the nail on the head. And that is, it's preventive as opposed to what's the word?
Episodic or urgent.
Urgent. Yeah, I like that. It's preventive as opposed to urgent.
Right. And our nurse here.
Yeah,
the old nurse. Yeah, you take her out of the hospital, but
still a nurse. Always a nurse.
Always a nurse. That's right.
Yeah. So, but I think that's really important. And as I mentioned, I had been in a car accident a long time ago, and so I've been seeing chiropractors off and on for many years at this point. And I've gotten into the position where I'll feel like, oh, I'm feeling pretty good. I won't see my chiropractor for a while. Or when I moved to a new location, which happened now a long time ago, I didn't automatically go looking for a new chiropractor, whereas I did automatically go looking for a new dentist and a new doctor.
Right.
You know,
it's the first thing you think, oh,
yeah.
gotta find all those things, put them in place.
But I didn't find a chiropractor right away, and so I have been dealing with some neck issues ever since, and so that's definitely something I'll remember the next time we move.
Right, yeah, it's to add that into the system.
Right.
And he mentioned that too. You know that we take care of our go to the dentist. Get to cleaning a couple times a year and so forth. That just to build that in makes good sense, and it just like I said during the conversation, part of why we do this, why we have Mighty Married Moms, is that we want to create the life that we've always wanted. Mm-hmm. And the life that we've always wanted doesn't include being immobilized from discomfort or having rusting joints. It'd be better to kind of keep moving, keep going, keep vibrant, keep healthy, and enjoying the kids that we have, enjoy the relationship that we have, enjoy the life that we have, enjoy our own bodies. So it just makes good sense.
Absolutely, and I think one thing that he pointed out that I find nutritionally as well is that people just sort of accept how they feel. Like they think, oh, I feel tired, I feel sluggish, and I can feel kind of like I can't stand up first thing in the morning. It takes me a little while to get kind of mobile,
loosened up.
You sort of feel like, oh, I'm kind of stiff, and you just think, oh, well, that's just
normal.
It's
aging.
It's aging, and that's how I'm supposed to feel. And he was really pointing out that's not at all how you're supposed to feel. You're supposed to be, very fluid and have full optimal movement, which is optimal wellness. And I know I always tell when I teach my fitness classes, you're only as young as you are flexible. And that it's really important to keep your body, your joints all fluid. And as he was also saying, with chiropractic care, those subluxations and making sure all the vertebrae are aligned, it's not just aligning your vertebrae and you're going to stand up straighter, but you're going to open up your nerves and your other tissues, and it affects your digestion. It can affect your ears. It can, it's really incredible. Everything's interconnected.
Absolutely.
Right? So you don't realize how interconnected you are, and when you go get those adjustments, they're really amazing. And I have to say that really the ART chiropractor is the one to look for. And
what does it stand for again? ART?
Active Release Therapy. And so they're releasing that soft tissue as well, and the scar tissue that builds up when you have an injury, or just really, I carry my pocketbook on my right shoulder all the time. When my kids are little, I was always really carrying them mostly in my right arm. And over time, and our bad posture, and leaning over cooking, leaning over looking at our computer, it all starts to affect your body, and your body starts to adjust and
maladjust.
Maladjust, yeah. And so if you're not getting that counterbalanced all the time, you start to, I know when I went to him, it's like my shoulder blade was almost like glued to my rib cage because I had compensated so much that I almost had frozen shoulder.
Wow.
And so they are able to release all that scar tissue and also adjust the subluxation.
It sounds so pleasant. Release the scar tissue. It sounds like it hurts.
They're pretty good at not making it excruciating by any means. It does hurt a little bit, but I'll tell you, the after your treatment is amazing.
Because you have that mobility,
and I couldn't lift my arm higher than this, so
I remember that.
I'm all free movement now.
I remember that.
It's a great thing. And I think one thing I really appreciate about Dr. Weiss also is that he has provided me with a lot of exercises to do in between. It's not like, I'm going to adjust you and you just have to keep coming back to me to get adjusted, and there's nothing else you can do preventative on your own. So he's teaching me what to do on my own as well.
That's really cool.
I think that's really important.
And he said that particular modality of active release is just about 20 years old. It's not been around very long. Mm-hmm. And that there's only 7 or 8 in this whole state of Massachusetts, and he's got 3 of them in his own office.
Yeah.
And so I was saying, how can we find them if you're not in Massachusetts? So he said activerelease.com. So you can just go to that website and put in your own
wherever your
zip code or city and find somebody that specializes in that type of care. And he said his results, he's been a chiropractor for 40 years.
30 years.
Mm-hmm. And so he said it's just been amazing what it's done for his own practice and the results that he's able to get. So anybody that's, that experienced, and says that this modality really makes a big difference. I'm up for hearing more.
Yeah,
So
absolutely.
that's great. Yeah.
Absolutely.
Yeah.
One of the things that I liked was his term spinal hygiene. And he talked about kids carrying backpacks at school all the time, and
they have to carry the heaviest backpacks. Oh my gosh!
In college, in particular, they have books that are this thick. I'm holding up my fingers about 3 inches, and the books are getting bigger and bigger. Although, fortunately, more schools and colleges are moving to textbooks that are online.
Yeah.
So that will be helping a lot, and a lot of schools are also starting to move toward carrying iPads or small computers or whatever.
So the books are loaded on
the books are loaded on there, but they're not. That's not the case everywhere by any means.
Yeah.
There's still a lot of kids who are injuring themselves by carrying those backpacks, and it's not cool to put it on 2 shoulders. It's only cool to put it on 1. So,
well,
for adults too. I mean,
Yeah.
I was carrying mine on 1 shoulder.
Right, that's too, because it's like a whole other process to put it on.
Yeah.
And then you take it off, you got to take it off of both shoulders. So you just end up whipping it over one.
Whipping and getting out of there.
Yes.
Yeah, it's true. Mm-hmm. It's true.
Yeah. And we're creatures of habit. And
Yes.
we really do tend to. And you're stronger. You're right-handed or you're left-handed. And I know it feels different when I carry my pocketbook or my backpack on my right shoulder than it does on my left.
It does.
It just sort of naturally do that. But I think, I also, for me, because I'm a patient of Dr. Weiss too, is that he really taught me a lot about posture, and posture is really important. And the bad posture,
As Wendy sits up.
I keep doing that every time we've been talking.
bad posture adds a lot to that spinal decay.
Yes.
And so it's really, really important to have good posture. I can't believe the difference in noticing my posture and really how to sit with my shoulders down, relaxed, my shoulder blades down, kind of pulling them down my back so I'm not having my shoulders up like this. I'm not like tense like that. And my shoulder pain almost instantly, like I wouldn't say instantly went away, but it was a pretty brief period of time once I started doing that and getting the chiropractic care and getting the release of that scar tissue was really phenomenal. And
so it's multiple things is what we're talking about here. It's getting regular care. It's learning how to hold yourself properly. It's learning how to manage your environment. Mm-hmm. Whether that environment includes a backpack or a purse, or if it includes a chair and where your computer is sitting. One of the things that I've worked hard at when I was teaching was to make sure that my seat was was low enough so that I was eye level with my screen. Since I use a laptop, that's a lot harder to do now because the table is down here, and so I'm doing this, putting my head down a lot, and I'm sure that's part of the reason I'm still having neck issues.
Oh, maybe.
So one of the things that my husband and I have talked about is either getting a standing desk or raising up the laptop and then getting a separate keyboard.
Yeah.
So, I mean, there are a lot of things that we can do to be proactive in making sure that we create an environment for ourselves that's healthy.
Right.
Yes.
Yeah.
Right.
Absolutely.
Yeah. He said, I love that quote with George Burns. That George Burns said, when he got to 90, he said, if I had known that I was going to live this long, I would have taken better care of myself.
Yeah.
Yeah. And so that's
We should imagine that we're going to live to 95.
Absolutely.
Exactly.
And if I'm going to live to 95, what do I need to do to take care of this body, this temple?
Right. Yeah.
What do I need to do to take care of myself?
Right. Right. And
Absolutely.
so that we're not, like you said, in the old age home and getting a lot of care. So it's really very interesting. Instead of just
Aging is not for sissies.
It's not. It's not for the faint of heart.
My parents and my parents-in-law keep telling us that.
Yeah.
Dr. Weiss has a poster.
Oh, really?
This woman on the poster is like in her 80s or whatever, and she's in a swimsuit with her cap on, and she looks unbelievable. And you think, that's what I want to look like when I'm 80.
That's right.
And it's true. It takes a lot of care, and I think you said, we think about flossing our teeth, but we don't think about adjusting our spine. And it's really, as I always tell people with nutrition, if I was the best flosser in the world, but I never flossed my teeth, before I went to the dentist, I would do a really good job, better than my friend will say, Debbie here who flosses every day, whose gums do you think are going to be healthier? Just because I'm the super flosser before I go into the dentist.
One day a year.
One day, she's going to have better dental health than I. And the same thing, your back, you've really got to. You don't wait until you get the injury, or don't wait until you start to have all those, aches and pains, or wait until your arthritis is at a certain level. Do it now so that it won't happen.
Right. One thing I found interesting was his. Did I hear him correctly when he said that you could bring in a kid with curvature?
Yeah.
And he could correct the curvature, and if need be, go to a brace, and the last resort is surgery. Well, in my experience with my friends, I never had to deal with it in my own family, but you have scoliosis. Let's sign you up for the operation.
Yeah, it doesn't need to be that way.
That there's enough.
If we're proactive, see, that's the point. You need to be proactive early, just like with any other health situation.
Yeah.
Be proactive as soon as you find that there's a little bit of an issue, or actually even be proactive and take care of yourself before you have an issue.
Yeah, but
ideally.
proactive in this case could get to the surgeon earlier enough. But what I'm hearing, this proactivity is about, listen, we can make some adjustments with this person. Doesn't have to go under the knife.
Which would be fabulous.
And not have a piece of metal rod in there, and avoid
who wants that?
avoid the thing at the airport for the rest of their days.
Yeah, plus the fact, every time you have surgery, every single time, no matter how routine the surgery is, there's always a risk.
Sure.
Absolutely.
Always a risk. So many different risks.
Right.
So whatever you can do to avoid going under the knife and having anesthesia is always preferable.
Is a preference. Exactly. Yes. Exactly. So it's
and it's a relatively simple thing to do. Just go see your chiropractor. Now, one thing I should have asked him, and I don't know, maybe you know what he recommends because you're his patient, Linda, is how often does he recommend people go for just maintenance?
Well, he did say something about 6 weeks. A month is 6 weeks.
Okay.
People go for regular maintenance depending on their body and what their needs are. But definitely people have whatever they're coming in with. I know when I went in, I was going 3 times a week and then down to 2 times a week.
Right. That's during an active treatment when you have an issue.
And then it was, I think it's about every 6 weeks or so. He recommended that I come back in.
Okay.
And knowing that I try hard not to, but we just do. We're hunching and we're carrying on the shoulder and we're just doing all that stuff. And we really,
it's daily life.
It's daily life, and it's going to happen.
Right.
It is what it is.
Right. Exactly.
And if you wait too long to go, that's the thing. If you don't do the maintenance, then you start to feel, gosh,
it comes back on you.
It really does come back on you.
Yeah.
It totally does.
Yeah.
Yeah.
And like we talked about the baby, I just still can't imagine what does he do with a little infant. Have you ever seen it?
I've never seen it done, no.
No.
I bet it's on YouTube.
It probably is. Yeah, maybe he has his own.
Not on YouTube.
Yeah, right. Probably has his own video of care.
Yeah.
For little babies, but it really sounds like a whole family way of really taking good care of yourself. So ever since you started talking about anti-aging or aging well, it's really made an impression on me. It's not something that I was very conscious of. Both you and he said the same thing, that we don't have to take things for granted, that, of course you're going to get slower or more decompensated as time goes by. There are things to do to kind of disrupt that or interrupt that or keep vibrant and healthy. Back in the old days, the farmers, they were out there all the time, milking the cows, getting up at 4 a.m. So they were keeping their bodies going all the time.
There was a lot of movement.
Right.
And that was what he talked about, is constantly moving.
Right, but we're in a different age, information age, doing a lot of work at computers, where getting up and moving is not necessarily part of it. What did you say earlier, too, something about flexibility? You're as old as you are flexible. What did you say?
You are as young as you are flexible.
You're as young as you are flexible. Yeah,
Yes, very, very, very important. And I know I've read in certain countries where the vocation or larger vocation is farming or things like that are a bigger part of the culture, and women carrying babies and farming and picking crops and things like that, they don't have back issues. They don't have all the stuff that we have. So pretty interesting. And they're moving and they're doing hard labor, but they're moving and they've got the proper posture and they're probably not bent over their computers and their TVs and their laptops and and so it's really it's a really a big deal. But anyway, we are. That's our show for today, and we are thrilled to be able to talk with Dr. Weiss. And again, His website is performancehealthcenter.com. They're located in Natick, Massachusetts, but as he said, if you're not in Natick, Massachusetts, and you're wondering about an ART chiropractor, you can call their office and they will help you find somebody in your area, or you can go to activerelease.com website and you can find somebody. And as a patient of an ART chiropractor, I would have to say it's a big difference, and I would definitely recommend, if you haven't looked into it, definitely look into it. And again, we're Mighty Married Moms, mightymarriedmoms.com, and please subscribe to our iTunes channel, Mighty Married Moms.
Yeah.
Thanks for being with us today, and thanks for listening in, and we will and watching, and we will see you next week.
Thanks.
Thank you.
Thank you very much.
Thank you for joining us for this episode of Mighty Married Moms. Tune in twice a week on Mondays and Thursdays to meet fascinating and inspiring guests who will help you create the life you've always wanted.
You can find these episodes and special gifts just for you at mightymarriedmoms.com, as well as a link to our Facebook community,
where we continue the conversation around the kitchen table. Please also help share the love by leaving a review on iTunes. We'll see you next time.